name's Nick Stafford. I'm a consultant psychiatrist in Leicester. I'm also the vice chairman of the MDF Bipolar organisation, the national charity. Bipolar disorder is a disorder of mood or mood regulation.
It's characterized by extreme mood swings, which is why the disease was once known as manic depression. Today, nearly 6 million American adults suffer from the condition.
I was diagnosed in 2010 with bipolar disorder. I was 20 years old at the time, and I was diagnosed at the psych ward in Lincoln, Nebraska, after I had had a severe manic episode.
Many groundbreaking creative thinkers are thought to have suffered from bipolar disorder, including Beethoven, Virginia Woolf, and Sylvia Plath. In more recent years, Ben Stiller, Sting, and Larry Flynt have all spoken openly about living with bipolar disorder.
People living with bipolar disorder experience dramatic shifts in mood, energy, and thought.
The dramatic mood swings of bipolar disorder are different from normal ups and downs. These mood swings shift from periods of frenetic activity or manic moods, which may include excessive spending, promiscuity, and little sleep, to hopeless, depressive moods characterized by excessive sleep, lack of interest in life, and lasting sadness.
When I think about the challenges of making a bipolar diagnosis, two things come to mind very clearly. We have two types of bipolar disorder. Bipolar type 1 illness is when a patient has had at some point in their life a manic episode. Bipolar type 2 disorder is when a patient at some point in their life has had that milder form of what we call a hypomanic episode. There are symptoms of mania and symptoms of depression. Symptoms of mania are really associated with not only an elevated mood, but a change in energy and sleep and impulsivity. And those really are the hallmark symptoms that we look for diagnosing mania. Not sleeping, not tired, energized, productive, sometimes creative, an elevated, sometimes an irritable mood. Those really are hallmark symptoms that we look for when diagnosing mania.
Because it is sometimes difficult to tell the difference between normal mood swings and symptoms of bipolar disorder, many people suffer for years before the illness is properly diagnosed. Once diagnosed, it is a treatable illness, but bipolar disorder must be carefully managed throughout a person's life. If you think you might have bipolar disorder, please see a mental health professional.